All meters can share the same common technique. You would take a meter, put a strip in here. There's different sizes of strips. Some are very, very small. Some are fairly good size. You want to make sure that you're able to handle the strip properly. Some people have dexterity problems. Some men who have very big fingers. People who have neuropathy may need a larger strip so they can have something to actually hold on to. When you put the strip in, the meter will recognize that strip, and it's necessary to get a drop of blood. There's a number of different kind of lancing devices. Excuse me, my ear is itching really bad. Okay, let's start over.
And just, that was perfect.
Okay.
You were like borderline going a little bit too low with
okay.
it, so just be aware of that.
Okay.
That was great.
Okay.
Whenever you're ready.
All meters share a common technique in that you have to get a drop of blood from someplace. Most of the meters will have a little strip. One of the things you want to look at is to make sure that strip fits your needs. A lot of people will have problems with dexterity if you have bad arthritis, some men who have really big fingers. Sometimes some of the strips are a little too small. So work with whoever you're getting the meter from, be it the pharmacy, the healthcare professional, to look at a variety of them and make sure you can handle it, that you can hold it properly. When you put the strip in the meter, most of the time it will turn the meter on, or there's a button somewhere that you will push to turn it on. Now it will be necessary to get a drop of blood. We recommend you wash your hands really good with soap and water. Warm water helps to promote circulation, especially if you have some problems with your fingers being cold, or as you get older, your circulation gets bad. Make sure that, again, washing your hands with soap and water and drying them well is a good thing to help to promote blood flow. There's a number of different kinds of lancing devices. All of them will contain a lancet, which is a very small, pointy object. There's a variety of different ones. Sometimes they will have a number of lancets already in the little cap so that you don't have to change the lancet every time. Some of them you put a new lancet in each time you use it. Again, work with your healthcare provider, the pharmacist who's providing it, to make sure you're getting the one that works best for you. Once you've got you've decided on a lancet, usually people tell me that it works better if you poke the sides of your fingers. You want to stay away from the pads because that part has more sensation and will hurt more. A lot of people complain that their fingers burn or sting after pricking their finger after obtaining the drop of blood. In that case, you might want to, again, make sure that your hands are clean. If you use alcohol to prepare the skin, make sure you wipe the alcohol off well, because injecting alcohol into the skin while you're making the finger puncture sometimes can cause it to sting. Maybe you're putting on too high of a setting. If most of the meters nowadays require a very small drop of blood. So if you're having lots and lots of blood, crank back a bit. You don't have to make a big hole in your finger, just a small puncture, again, to get just enough blood to fill the little well on here. Most all of them will have some type of a little receiving area where once you get that drop of blood, you will then just hold it up against it, and it wicks up the amount of blood it needs. It will beep then for you when it has enough blood. That is a very key issue, making sure that you have enough blood on the strip. And the meter, almost all the meters will give you some indication that you do have enough. If it doesn't beep, or if you still have part of the little receiving part that's not full of blood, you can get an erroneous reading. So just make sure that you're getting a good drop of blood. In the olden days, you had to have a hanging drop of blood that you placed on top of it. Most of the meters now, as I mentioned, you just touch it and it will wick it in. Now, some people, again, will tell me that their finger continues to sting or something afterwards. I read an article a number of years ago that said taking a little bit of an antibiotic and dabbing on it after you've done the finger prick. So after you've got your blood sample, put it on the strip, put it on the strip, and then put a little dab of antibiotic on it after the fact. Helps to take out that stinging kind of after effect.